Mental health today, the obesity epidemic for kids. There are new weight loss drugs that are now available for patients as young as 12, but should they replace counseling and other options? Here to talk about that is Dr. Kevin Simon, a psychiatrist at Boston Children's Hospital and the Chief Behavioral Health Officer for the Boston Public Health Commission. Always good to see you. Thanks for being with us.
Hey, doctor, thanks for your time on this Monday. So let's start with the FDA. The FDA has approved new drugs such as Wegovy for people 12 years and older who meet specific guidelines. So what do parents need to know about that?
Yeah, and again, thank you for having me. In terms of what I'd stress as a physician is that while there are medications like Wegovy that show promise for treating obesity, obesity itself is not just like a lifestyle issue. It involves genetics, metabolism, the physiology, and kind of behavior. So medications like Wegovy should just be a part of a comprehensive lifestyle plan, and that parents should definitely talk to their child's healthcare provider in terms of trying to come up with a potential plan, because medication shouldn't just be the end all be all.
Or the one avenue, right? So we hear
Correct,
a lot
correct.
Doctor, about the physical toll of obesity on kids. There's an emotional toll as well.
Yeah, no, you're exactly correct. In terms of obesity can unfortunately cause emotional distress. Oftentimes students or youth who are obese tend to be those that experience more bullying, lower self-esteem, body image issues, which then exacerbate worsening depression, anxiety, feelings of shame. And so if you're a person that is a loved one of a youth who is obese, it's important to emphasize that obesity is not necessarily just their choice, and that there is a total plan around being able to treat them and do well. So emotionally, individuals that have obesity can unfortunately experience worse emotional outcomes.
They can, but there's a path to help them out there too, which is very promising and can be helpful. So experts have told us that they're concerned about the lack of equity and access to treatment options for obesity. So what, in your opinion, what's the problem?
Yeah, so access to obesity treatments is a problem. Oftentimes, medications can be costly. They aren't always covered by insurance, in part because the insurer doesn't have the long-term outcomes to indicate that it's in the insurer's mind worthwhile to pay for it. And then, unfortunately, in high obesity communities, there's often a lack of resources associated with making kind of healthier choices. And so your fresh markets tend to be this idea of food deserts in certain communities, and unfortunately those food deserts then have a propensity of high caloric intake foods accessible to people. So the access to both treatment, healthy lifestyle is important for individuals, and again, not just medication. That should be a part of a holistic plan for a patient and their family.
Yeah, just one route along the way.
Dr. Simon, we always appreciate learning from you. Thanks for being with us. Stay well.
Thanks, doctor. Good to see you. Take care.
Thanks. Thank you.